Good day, fellow learners. Once again, this is your mentor, your fact check buddy, Ray Gapuz, joining you for our learning and teaching session number 15. And before we move on to our business in today's session, I'd like to ask you to join us in this mission. Our goal is to provide free NCLEX RN application interview to 100 nurses. We actually have increased it to 300 this year. For the past 2 years, we're able to do this and give our colleagues from the Visayas and Mindanao equal chance of turning their great American dreams to reality through our system. So to help us achieve this, just watch and finish the ads in our videos. Please don't skip. That's the only thing I ask of you. And thank you very much in advance for doing so. I'd like also to say thank you to one of our multitudinous benefactors, Miss Tessa. She just wanted to be called Miss Tessa. And this is what she shared with us. Hello, Dr. Ray. I passed the NCLEX. I'm so beyond grateful. I want to share my blessings through your scholarship. I will give 20,000. Kindly send me the bank details. Dr. Ray, please don't post my complete name and pick in the SOCMED. Hope you understand. My next message can be posted. However, kindly just show my name, Tessa. Thank you very much, Miss Tessa. And I'm speechless. Thank you for your contribution. I'd like this public advisory known to everyone that me, Dr. Ray Gapuz, and the mentors of the Ray Gapuz system are not part of another center named Gapuz Review or Gapuz Review Academy. So if you want to avail of the system that we are doing here at the Ray Gapuz Review System, please look for the official Facebook page. It's a Ray A. Gapuz Review System, not just Gapuz Review. No, we're not part of that company. Okay, so if you don't see any one of us in your class, it's not a Ray Gapuz system class. So we have our promo, get a free review from us if you process your NCLEX RN application with ITAPS Gapuz. So ITAPS Gapuz is our accredited partner for quick NCLEX RN processing. You could actually have your ATT in a short period as 3 months, and we do it with a more affordable cost because our package begins with 45,000 all in, and you get free review if you process with ITAPS Gapuz. So here's one nurse. Her name is Pearly Grace Bicasan from Baguio City, and this is what she says about ITAPS. Thank you so much, Ma'am Sir, for all the assistance and guidance po. Salamat po sa inyong lahat. Kindly extend my message to Sir Ray. I may not be visible during those reviews, the bootcamps, but I am so grateful alongside. My pamangkin already had joined the RAGRS to be a future USRN as well. I could not thank you all enough. More power. Remember, at ITAPS Gapuz, we process your NCLEX application faster. So here we go. Let's talk about case number 15. And this is about conduct disorder. Now, a lot of people are confused about how your oppositional defined disorder, conduct disorder, and antisocial disorder differs, or how are they similar. So first and foremost, they could be similar in terms of the behavior, their expression of emotion towards other people. They could be similar in terms of the most common risk factors, which could be associated with an abusive family environment. However, they usually differ in terms of onset. So on to our day's discussion. But before that, let me say congratulations to Miss Lester June P. Chumaco, BSRN from Easter College in Baguio City, who passed the Texas Board of Nursing last August 8, 2024. And let's learn from her success recipe. When the time is right, I, the Lord, will make it happen. Isaiah 60:22. My journey before taking the NG and NCLEX has a lot of struggles. Having 2 jobs while completing the requirements in my research study didn't dismay and stop me along the way. That was because of the full support and guidance that the Ray A. Gapuz review system provided me until I passed my NG and NCLEX. Thank you so much, Doc Ray, and to all the staff of RAGRS. I am blessed that this company is composed of valuable, passionate, and amazing people. Moreover, the functional concept is totally solid and helpful. I'm 100% sure that for as long as your foundation and concept are intact, There will be no question that you cannot answer. I utilize all of the methodologies that the company is offering: the comprehensive review, the bootcamp, quick fix sessions, the learning management system, the NGN NCLEX 311, which I read a day before I took my exam. That remains a common denominator for all of those who pass NGN. I also get to love answering both PDF and online exams, which help me master my skill in choosing the correct options for every question in the actual NGN NCLEX. Mabuhay ang Ray Gapuz review system. May God bless you more for this in this company. To God be the glory. And that's Miss Lester June Chumakog, USRN from Baguio City. Okay, so let's move on to our topic for today's discussion. And this is about conduct disorder. Now, conduct disorder is characterized by the keyword consistent pattern of aggressive and disobedient behaviors. The onset is between 10 to 19 years old. Now, this is where I'd like to highlight the differences in terms of onset from several other conditions which may have almost the same presentations as your conduct disorder. For example, oppositional defiant disorder, the onset is usually from 5 to 10 years old. And then you have antisocial personality disorder. The onset is usually 18 years old and above. And of course, your attention deficit hyperactivity disorder in DSM-4, the onset is before 7 years old. But in DSM-5, it has been updated to before 12 years of age. So it's like if you have these behavioral patterns associated with aggressiveness and disobedience from age 5 to 10, think about oppositional defiant disorder. If you have it from 10 to 19, think about conduct disorder. And if you have it from 18 years old onwards, then think about antisocial personality disorder. However, if you have hyperactivity apart from the aggressive behavior and impulsivity, then you can consider attention deficit hyperactivity disorder, especially if the child is yet to turn 12. So the onset of ADHD is before 12 years of age. Now, what are the common risk factors for conduct disorder? This includes, remember the code lot, low socioeconomic class, abuse of drugs or substances by the parents. So these kids grew up in an environment where the parents are abusing substances, which could have contributed to the maladaptive pattern of behavior that the child developed. And of course, domestic violence. Now, your conduct disorder is characterized by, remember, dads, destruction of property. So the person could be throwing properties, or they are just secretly destroying things that you love. Aggression toward people and the animals. They're cruel towards animals. They use the animals for experiments. And sometimes you'll get to see your dogs already tied and tied to a tree, or you get to see your pet bird already tied also, and at the same time placed near a dog. Okay, so they could also be deceiving, lying, or stealing. Sometimes they have serious violation of rules. Now, serious violation of rules is also an outstanding manifestation of antisocial personality disorder. They habitually break the law. So there's a great chance that a child with conduct disorder eventually progresses into a person with antisocial personality disorder. Okay, so these types of children therefore could engage in verbal threats, or they could be engaging in bullying behavior while in school, or they could have truancy, which means they're not attending classes or they're cutting their classes. And the treatment for conduct disorder includes a multidisciplinary approach. So since the origin of the condition is in the family, so we begin with the parent management training. So we teach the parents what to expect of the child and how they promote normal growth and development. And then, of course, psychotherapy or talk therapy to handle the hostility of these children. Anger management training is indicated. And of course, in order to modify their thinking process, cognitive behavioral therapy is also indicated. Plus, if there's a facility in the community, a school where their behavior can be properly handled, then we refer them to a community-based treatment facility. So before we move on any further, I'd like to share with you the good news coming from a user of our NCLEX RN 311 book, the Next Generation Quick Fix Edition. And this is Leslie. Hello, survey. I passed. Thank you so much. Hindi ko po kaya kung wala po yung tulong niya. And I said, wow, congratulations. Which part of our review helped you the most? She says, all. I utilized all your unlimited resources, 3 comprehensive reviews, 1 bootcamp, 2 quick fix, face-to-face, finished all the activities in the course shell, answered your TOP, watched the latest YouTube videos, followed the study guide from Sir Ray, and lastly, the powerful 311 book that I read a day before my exam. So it's a common denominator among passers. They are reading this book. Okay? So don't get lost in terms of your focus. Okay? And the most important thing that you have to do is to move forward, have the right resources, and NCLEX 311 book is one of those resources that I can definitely recommend if you are rushing to pass your NGN. So here we go. Let's answer case number 15. The parents of a 14-year-old were called for a meeting with the principal and the school nurse. The class advisor noted that the child has been frequently absent in his classes. The parents arrived separately. That's a red flag. The child has been living with the grandparents, another red flag, and has been recently involved in verbal fights with some friends. So once you get to see the red flags, focus on the onset of the behavior. So you have here a 14-year-old child. So what did we say a while back? If you notice some behavioral disturbances from 5 to 10, it could be oppositional defiant disorder. Then 10 to 19 could be conduct disorder, and then 18 and above would be antisocial personality disorder. So we can consider those things. So let's move on to the sample question. So the nurse should suggest a set of interventions to address the child's condition, which is most likely associated with, is it attention deficit hyperactivity disorder? We don't have the impulsivity and hyperactivity. We didn't notice that in the situation. And the onset is already past the age of 12. ADHD will have the onset before age 12. According to DSM-5, DSM-4, onset is before age 7. Conduct disorder, well, it's within the age of onset. 14 is within 10 to 19. Oppositional defiant disorder, well, the age of onset is from age 5 to 10. So in our case, we have a 14-year-old client. So we may not potentially consider number 3 as the correct option. And of course, antisocial personality disorder, the onset is usually age 18 and above. So the best answer to this question is option number 2, conduct disorder. Okay, so if you want to learn more from me, join me in a 10-day challenge. I'll be the main mentor. Join our Quick Fix Bootcamp for NCLEX RN. It's going to be done from November 13 to 24 at the Mount Crest Hotel. That's our new home in Baguio City. And the program includes our pharmacology book, nursing reminder sheet, NCLEX 311, the Q-Bank, unlimited sit-in, plus our core shells. So if you want to book a slot, better make it early because the slots usually sell out a few days before the test. So join our hundreds of thousands of passers from all around the world. This time around, we have nurses from more than 35 countries joining the Ray Gapuz system. So the second rule, if you want to pass NJN, learn how to navigate technology. Why? Well, some of those students who get into our system would say, we know the concept. But when we're studying on our own, we are not exposed to the kind of technology that Ray Gapuz system would usually expose us to. So that's one important aspect of our test preparations program. You are in a simulated environment. And of course, our learning tools are published by world-renowned publishers. And we have our own learning management system that covers all the topics on the test. Plus, the third, but the most important component in your preparation should be a conducive environment that should help you keep your focus. The Ray Gapuz system will limit our students to a comfortable number, plus we have our own simulation laboratory. So may I ask you to join us in our next generation NCLEX RN Flex, the most flexible test preparation class for the NCLEX RN, and our fee starts at $3,499. Your choice of live face-to-face class, live virtual class, on-demand unlimited video recorded lessons, our QBank plus my 3 books, and NGN strategies and sample questions from me. Plus, you can join my 3 days, 24-hour, conducted in 3 days, quick fix sessions, live, either face-to-face or virtually. So once again, this is your mentor, your fact check buddy Ray Gapuz, saying, until our next video, a functional concept a day keeps your NCLEX RN fears away. See you in our next teaching and learning session.